Good afternoon, everyone. My name is Candace, and I work for Nutritional Frontiers, and I've been working around here and at the Wellness Center for a couple months since the summer, so I'm seeing some familiar faces here. I'm going to talk about bone solutions here, some bone health, how to maintain bone health and regrow bone. A few weeks ago, I was talking to a new friend and asking him, what do you do? What's your job? And he says he sells some kind of medical tool, and he was interested in selling pieces for the knee when you get knee replacements and, people who have trouble with the knee. And he was saying, I think I'd be a good salesperson for that because I'm compassionate about it because I have knee problems. Anyway, I asked what kind of knee problems he has, and he says the bone in his knee is just deteriorating. He doesn't have strong bones, and he said, the doctors told me there's nothing I can do, so I'm kind of stuck with it. And so I said, how many bones are you born with? And he goes, about 200, he's guessing. I'm like, you're close, but it's a trick question. You're not born with any bones. You're born with cartilage. And he looks and he's like, how do you know this? Like, why have I never heard this before? And so I started to tell him, you're born with cartilage, and as you grow and you're fed nutrients and minerals and all these vitamins, then bone forms. When you're born and when your bones start to grow, they're very small. I wasn't 5'4" when I was born, so my bones have been growing my whole life. So I told him, vitamins, nutrients, minerals, your bones grow. So that kind of changed his perspective a little bit, and he was kind of frustrated with the medical doctors he had seen before. So it's just a fun little story that, the medical doctors kind of surpass all of these. Meanwhile, they're recommending Fosamax and all these prescriptions that are supposed to feed you calcium and help your bones grow and be strong. Yet they recommend a calcium supplement as well, but if these prescriptions are supposed to help your bones grow, why would you need calcium? So, the minerals in your bones, the main ones are calcium, phosphorus, and magnesium. And if you look at this little reference chart, it tells you in males and females, they're the same. The mass of magnesium, calcium, the minerals in your bones. So it just shows you that, their bones are the same. This is just another little chart, shows you the mineralization and all the scientific things behind the bones. This is a chart showing how important vitamin D plays a role into your bones, whether it's from the sun or from food, and of course from supplements, how it transforms and is metabolized through your systems to help build bones.
Is that vitamin D3?
Yes, that's vitamin D3. The functions of calcium, help bone development, maintenance, growing, and maintaining to be strong. It helps with blood clotting, which is something you don't want to have, muscle contraction, and even at the cellular level with metabolizing cells. Bone development and maintenance. So bone is made of hydroxyapatite, which is a calcium phosphate salt. It's deposited in the bone by osteoblasts, which build up your bones, and reabsorbed by osteoclasts, which help maintain the levels of calcium in your bones. Peak bone mass is reached between the ages of 20 to 30, so someone my age would be at their peak. And after this, bone loss is common to occur, but if you're taking supplements and keeping your intake of calcium and vitamin K and D and all those things that help your bones, then you can prevent that bone loss. Calmodulin is an important protein that binds to calcium, and once the two of them are working together, it influences enzyme activity in your cells. So making sure your cells are working with the calcium and the calmodulin is important for bone growth. So this is another image on how your proteins work with the neurotransmitters and the calcium, and how calcium and calmodulin work together to form strong bones. For muscle contraction, your muscles and tissues and joints are all connected to your bones. So nerve impulses stimulate skeletal muscle, so your nerves in turn stimulate your bones. Calcium ions are released from the cellular level into the bones, and when calcium is drawn out of the muscle cells, then your muscles relax, and that's when it's coming into bone and out. Calcium also plays an important role not only in your bones, but in other areas. It can decrease blood pressure, so if you have high blood pressure, that may be helpful. It can decrease the risk of colon cancer, so taking calcium can certainly be a good preventative measure of colon cancer. It can reduce PMS symptoms, and it can reduce the risk of kidney stones. So it's a good preventative supplement to be taking, or to make sure you're getting it in your diet. And these numbers just show you where your your recommended daily amount, what those are, and for your age. And it says toxicity usually only occurs with supplement use. You'll see through these supplements for the bones, there's not ever usually situations where someone is going to be toxic. At least in the United States, you don't usually see toxicity. Deficiency, that can definitely occur, but toxicity is rare unless you're overdosing or taking too many of your supplements. And also, it works with the intestines. Calcium is actively and passively absorbed through your intestines. And this is a great chart to show you where calcium is found in, if you're unsure of what foods may contain it and at what level. This is a great chart. If it's in the light pink, it shows you that it contains low amounts. If it's in the medium color, medium, and the dark is high, so you'll see milk, yogurt, and cheese. And the got milk ads kind of drive me crazy. Just the source of where the milk is coming from, animals fed with antibiotics, it's not the best thing for us to be drinking. Or if you look at almond milk or, different types of milk, maybe healthier alternatives, it says 50% more calcium than regular milk. So that's what I prefer to drink, and not only for the taste, but for the amount of calcium that it has in it. And 75% of calcium in Americans' diets come from dairy products, but you'll see that it is also found in other types of foods, and not just dairy. So calcium deficiency, it's the most common among the elements, and osteoporosis is something that it's very common in America. Dr. Weiner has helped hundreds of people reverse osteoporosis, as well as many doctors in this area who sell similar supplements and do similar treatments. They've actually reversed osteoporosis, whereas medical doctors may recommend prescriptions that cause antibiotics that will in turn cause fungal infections and for extended periods of time. So if you look at our supplements that are all natural, you're not going to have side effects like that. You're just going to get positive results. I like this picture. Like I said, your bones are at your peak in your 20s, right where I am. I'm about 64 inches tall. So that's kind of my height. That's kind of a picture of how I think of myself. And this picture is, not what I want to look like when I'm, older. So this image kind of is a reminder to me, make sure I'm taking care of my bones. While I'm at my peak now, I kind of feel inferior. That's never going to happen to me. But when I'm older, that's going to be something that I may be faced with. So I like this picture as a good reminder. It says she has a wedged upper vertebrae and a crushed lower vertebrae. That doesn't sound fun. It sounds really painful. And this is just more of like an x-ray of what those two things look like. And this is a definition of osteoporosis. It's a skeletal disorder, compromised bone strength, which increases your risk of fractures. So it's unhealthy bone that is in danger to fractures. Risk factors, some of these aren't, you can't really control your age, your gender, your family dynamics, but what you can control is your lifestyle, your diet, whether you smoke or not, if you're taking any, drugs, prescriptions, any of those things. There's no tricks to these. It's, either you want to make healthy life choices or you don't. So whether you have family history of osteoporosis, that's something you can't control, but you can control things like lifestyle. So some prevention, like I had mentioned before, calcium, magnesium, phosphorus, all good things to help prevent osteoporosis. Some treatment, the biophosphonates, there's over like 10,000 studies on that and how good it is for your bones.
What are biophosphonates?
It's an ingredient in, it's just a phosphorus ingredient that helps with bones.
Oh, okay.
Mm-hmm. So this calcium accumulation, it just kind of displays that you're at your peak in your 20s, and then it begins to go down. So as you're growing, your calcium is being absorbed more and more as it's building your bones. And once you're in your 20s, it peaks, and then it begins to go back down. And things like osteoporosis then, can occur with the lack of total amount of calcium. So again, phosphorus is one of the essential elements in bone growth. It also is found in body tissues, and it helps maintain acid-base balance, which, that's acid-base through your bones, through your muscles, your tissues, even the stomach acid. Phosphorus in your diet, this is just recommended daily dose, about 700 milligrams, which you may not be getting that in your food, so then that's when you would want to take a phosphorus supplement. Again, food sources, mainly found in dairy, also in some kinds of grains. We kind of saw these in that chart previously.
What's most of P in the diet mean?
Phosphorus.
Oh,
Again, like I said, the deficiency, for phosphorus, it is rather rare. You'll see that the toxicity, that's not usually your problem either. Magnesium is important. That works within the muscles, into your tissues, your joints, and your bones. It helps with nerve and heart function, and the insulin release from the pancreas, and insulin action, like you've seen in the picture prior with the neurotransmitters, that also plays an important role. Magnesium in the diet, again, this is just showing you the recommended daily amounts for what you should be taking. If you're on the upper limit, those are going to be a little bit higher, coming from supplements, if it's not coming from food, and that would be in addition to your diet. And here's another one of those great charts, a pyramid of high doses, lower doses, and it just tells you where you can get magnesium. Great reference chart. Again, magnesium food, grains, organic produce and grains, that's where you'll find magnesium. The deficiency, that's going to be more common, especially than the toxicity. causes rapid heart rate, weakness, muscle spasms, and sicknesses that follow, which if you are deficient in magnesium, that will increase your risk of osteoporosis. And this just says, toxicity is not usually common, which I've said over and over. Exercise, that's important to maintain bone growth. It should include resistance exercises, as well as weight-bearing exercises, and flexibility, stretching. Make sure you're stretching your muscles and your joints, which will in turn affect and strengthen your bones. So if you look at the Nutritional Frontiers protocol, these are going to be the supplements that aid to bone health, help rebuild bone if that's the situation you're in, or if you have healthy bones, it'll help maintain the state you're in. Super Cal Plus, that comes in capsules or tablets. The tablets are they're a bit stronger because you can suppress more into a tablet. Betazyme, that's going to help regulate the stomach acid. Also the vitamin D3, which I've talked about, 5,000 milligrams and 10,000 milligrams. It's recommended everyone with levels around 30 should be taking at least 5,000 every single day. Frontier minerals, that's just going to help with the minerals, phosphorus, magnesium, and calcium. And HA+, which has been our #1 seller for the past 10 years. Best results, which is why it's best selling for us. The Super Cal Plus, it's great because it's a vegetarian formula, which many of our customers and people looking to rebuild bones are vegetarians. It contains MCH, which is a whole food. It's just a whole bone food, so that helps. That's really what feeds your bone, and that works at it's absorbed about 95%. So however much you take of it is absorbed 95%. And if you look in the back of your handout, there's a little chart, Consumer Health Alert on calcium, and it shows the different types of calcium that are found in, if you go to Walmart or Giant Eagle, the supplements that you may buy there, they'll contain different forms of magnesium, calcium. Calcium citrate and calcium carbonate. And calcium citrate, that's absorbed about 55%, so it's half beneficial. And the calcium carbonate, that's absorbed 1 to 8%. So that 8% is very generous. It's a very generous statistic. We say it's about 1 to 2% absorbable, so why bother? I mean, it's so minimal that what you're getting from those supplements is, not beneficial at all. Like I said, the Betazyme helps to promote stomach acid, breaking down food, and your stomach acid needs to be in good health to break down and absorb calcium. So that's why the stomach acid is important. The vitamin D3, like I said, 5,000 IUs of that a day is our recommended with anyone levels around 30. Your ideal levels are about 70 to 100. We've never seen a cancer patient with vitamin D levels over 70. So, that's a reason to make you want to get your vitamin D levels up itself. Frontier minerals, proper composition of body fluids in the bones and your blood, help with nerve function, regulate muscle tone, and it contains 9 minerals that are easily absorbed. These are just some of the ingredients listed in the minerals, those 9 ingredients that I mentioned. There's the rest of them. HA+, like I mentioned, #1 formula, helping people out. It addresses joint and connective tissue health. It supports cartilage and synovial fluid, the parts of your bones. Mature bone is made of protein, which would be that calmodulin. Like I said, that's the protein that binds to calcium. minerals, water, and matrix. The matrix consists of 90% collagen, and that is the most abundant protein found in the body, as well as the entire animal kingdom. So that's the highest protein that you'll find. BioCell type 2 collagen, there's many studies done on that, on just how great of a formula or a form of collagen that is, the BioCell type 2. And this matrix has collagen and also hyaluronic acid, which is what the HA stands for, and HA+, hyaluronic acid. That has a U.S. patent on it, so it has been proven in multiple studies shown to work. That hyaluronic acid is distributed through the body and used for structural support, so that's going to support your skeletal muscles and skeletal bones. So if you take another look at the Consumer Health Alert in the back that talks about the calcium carbonate and calcium citrate. Like I said, that calcium carbonate is only absorbed at about 1%. That also increases the risk for cardiovascular diseases and heart attacks, just because it's very cheap. It's very cheaply made. Our products go through a 6-step purity and potency, step-by-step process to make sure that they are meeting label claims and just they're the purest and most potent form. I don't know if any of you remember a few years ago when Dr. Weiner was 59. He's now in his 60s. 59. He slipped and fell and broke his wrist, and the doctors told him it would take 3 months to heal. And so he was taking the SuperCal Plus and some of the other supplements that I mentioned. It took him 3 weeks to heal his broken wrist. So the doctors were blown away, and so this just goes to show that, along, of course, with his healthy diet and healthy lifestyle, that these supplements have really helped and can help to maintain and build up bone, as well as fixing, reversing things like osteoporosis that I mentioned, as well as healing broken bones. So thank you all for listening. Do I have any questions? Yeah?
I have a question. I've been researching dairy products and veganism and whatnot. And I've been reading about how dairy, in some instances, can break down bone. So it's like, I don't know if you believe in that, or if you believe in that theory, or.
What I know is it may affect your osteoclasts a little bit more, which break down bone, or it just may be a bad form of calcium. So.
Okay, so it can break down your osteoclast?
Well, you have osteoblasts, which build up bone, and osteoclasts, which break down bone, which is, a proper thing, but it may make that happen at higher levels.
Okay.
What kind of calcium and magnesium is in your calcium?
The MCHC is the kind of calcium, and the magnesium was the other one you asked. I believe that's magnesium glycerin. I can double check for you, but I'm pretty sure that's what it is.
And the MCHC is in what?
The SuperCal Plus. That's a calcium form. Anyone else? All right. Thank you.
Thank you.